The Maryland Department of Health would like to introduce you to the Prescription Drug Monitoring Program, also called the PDMP. The PDMP is one of the most important tools our state has to prevent drug misuse and ensure prescription accuracy. It's helping smart people make smart decisions every day. Hello, I'm Anna Lazaridis, the Provider Engagement and Policy Manager for the Prescription Drug Monitoring Program within the Office of Provider Engagement and Regulation. Here at the PDMP, we are always striving to help make your practice safer. With that goal in mind, let me introduce you to an important tool that helps you to safely prescribe and dispense controlled substances. The PDMP, which can be accessed through the CRIS portal. In this video, you will learn what the CRIS portal is, how to sign up, how to use it effectively, why reviewing a patient's PDMP report is mandated by the state of Maryland, and all the clinical tools, including the PDMP, that you can access through the portal. Let's get started. Overdose deaths have risen at an incredibly alarming rate in the United States. They exceed both firearm and traffic fatalities as the leading cause of injury death in America. In Maryland, the number of drug and alcohol-related intoxication deaths increased in 2020, reaching an all-time high of 2,799 deaths. And 89% of those deaths were related to illicit and prescribed opioids. In 2021 alone, prescription opioid-related fatality overdoses increased in Maryland by 15.7% from January to June. This follows a substantial annual increase of 22.8% observed in 2020. While opioid medications can be beneficial for many patients when prescribed appropriately, the risk of developing opioid use disorder, or OUD, is significant. For some patients who develop OUD but no longer have access to prescription opioids, turning to illicit opioids is a possibility. Approximately 75% of heroin users report they started using the drug after first using prescription opioids. Opioid-related fatalities have increased sharply in Maryland, driven in part by the large increases in the number of fentanyl-related deaths. This is driven by the fact that fentanyl is many times more potent than heroin. Non-fatal opioid-related overdoses are up dramatically as well. This has culminated into a public health crisis for Maryland. Every state has a PDMP. While there are similarities between PDMPs, each state's statutes, regulations, and policies differ. The overall mission of the PDMP is to provide accurate and accessible prescription data to help coordinate patient care by healthcare providers and optimize legitimate patient access to pharmaceutical care. A major goal of the Maryland PDMP is to assist healthcare and public health professionals in the identification and prevention of prescription drug abuse. The PDMP is also tasked with assisting law enforcement and regulatory agencies in the identification and investigation of prescription drug diversion. The Maryland PDMP is a secure statewide electronic database that contains information on all controlled substances, Schedules 2 through 5, dispensed in Maryland. By state law, the program is authorized to disclose collected PDMP data to credentialed users, including healthcare providers like yourself. The PDMP is a clinical tool for prescribers and pharmacists to assist with the medical care of patients. The PDMP gives healthcare providers immediate electronic access to their patients' Maryland controlled substance prescription histories. This enables providers to review controlled substances prescribed to their patients, as well as improve their ability to identify possible substance use disorders. Should a substance use disorder be suspected, providers can then refer a patient to the appropriate assessment, treatment, and recovery services. It also improves providers' ability to safely and effectively manage patients' pain and other conditions with controlled substances, increasing confidence in prescribing decisions and patient compliance, while decreasing the potential for harmful drug interactions. It takes a collaborative team effort to combat the opioid epidemic in Maryland. First is the Maryland Department of Health, or MDH, who is partnered with the Chesapeake Regional Information System for Our Patients, or CRISP, to make controlled substance prescription information available to clinical users. Next are clinical users who may access PDMP data through the CRISP Query Portal, through electronic medical record integrations at healthcare facilities, or through point-of-sale integrations at pharmacies across the state. CRISP provides user registration and technical support services for clinical users. The final team member is the dispenser, the pharmacies and other dispensers who are required to report prescription records to the PDMP. Dispensing a medication in Schedules 2 through 5, as defined by federal and state controlled substance laws, must be reported within 24 hours. Hospital outpatient pharmacies, community retail pharmacies, mail order pharmacies sending controlled substance prescriptions to Maryland addresses, and practitioners authorized to dispense controlled substance prescriptions must all electronically report identifying information about the patient to whom the medication was prescribed, the prescriber, the dispenser, and the drug itself. There are reporting exemptions that are important to know about when viewing PDMP data and making clinical decisions. Direct administration of medications and drug samples are not reported to the PDMP. Entities exempted from reporting include pharmacies that serve only hospital inpatients or who are waivered by the Board of Pharmacy for serving assisted living, comprehensive care, or developmental disability facilities exclusively. Also exempted are pharmacies dispensing to hospice patients and opioid treatment programs, including methadone programs. Federal Regulation 42 CFR Part 2 protects the confidentiality of drug treatment records from the opioid treatment programs. Veterinarian dispensing is exempt unless a prescription written by a veterinarian is taken to and filled by a retail pharmacy. We advise that some consideration should be taken when interpreting PDMP data. PDMP data are records of dispensing as reported and should not be considered the official record of a dispensing transaction. Only the original prescription can serve as the official record. Although all efforts are made to ensure data accuracy and completeness, reporting may contain errors or omissions. This may result in missing or incomplete records or multiple profiles in CRISP for which you might believe is the same person. If a dispenser confirms an error or omission in PDMP data, then please contact the PDMP to investigate the discrepancy. Email mdh.pdmp@maryland.gov or call 410-402-8686. Clinical users authorized to access PDMP data are grouped into 3 categories with specific definitions: prescribers, pharmacists, and delegates. Prescribers are any practitioner authorized by law to prescribe controlled substances in Maryland. Please note, this terminology differs slightly from what we use to describe clinical user access to other CRISP data feeds. The following are the terms of legitimate access and use of PDMP data. Prescribers and licensed healthcare practitioners delegated by a prescriber may access PDMP data in connection with the medical care of a patient. Pharmacists and licensed healthcare practitioners delegated by a pharmacist may access PDMP data in connection with medical care of a patient, including the dispensing of controlled substance medication. PDMP access is available to all who meet the definition of prescriber or pharmacist. Clinical data access, also called Health Information Exchanged (HIE) access, may be limited based on organizational affiliation and CRISP policies. If you have questions about who can access PDMP data and who is subject to any PDMP mandates, please refer to the PDMP page on the CRISP website or the MDH PDMP website. Delegates who are designated by either the prescriber or pharmacist can be licensed healthcare practitioners without individual prescriptive authority or other staff members who are employed by or under contract with the same professional practice as the prescriber or pharmacist. Prescriber delegates and pharmacist delegates may access PDMP data on behalf of a delegating prescriber or pharmacist. A person who knowingly discloses, uses, obtains, or who attempts to obtain by fraud or deceit PDMP data is in violation of Maryland's PDMP statute and shall be guilty of a misdemeanor. In addition, a prescriber or pharmacist who knowingly discloses or uses PDMP data in violation of Maryland's PDMP data statute shall be subject to disciplinary action by their licensing board. HIPAA applies to PDMP data, but there are additional legal considerations which you should be aware. PDMP data are confidential, privileged, not subject to discovery or subpoena in civil litigation, and are not public records. The release of PDMP data by a prescriber or pharmacist to another licensed healthcare professional solely for treatment purposes and in a manner otherwise consistent with state and federal law is protected under the PDMP statute. A main purpose of the PDMP is balancing appropriate management of specific conditions for which controlled substance medications may be indicated against risk associated with controlled substances, including substance use disorder and overdose. As you begin accessing PDMP data, you are bound to find information of note that may impact your clinical decision-making. The Maryland PDMP recognizes the need to equip clinical users with the resources to address issues uncovered through viewing a patient's PDMP data. Outlier patient behavior may be observed within PDMP data, such as early refills, overlapping prescriptions, or multiple similar prescriptions from different prescribers. Overdose risk may also be apparent in the PDMP. For example, high-dose opioid prescriptions or concurrent prescriptions for opioids and benzodiazepines. Talk with your patient about what you see in their PDMP data and consider whether screening for a substance use disorder, referral to an applicable specialist, or a prescription for naloxone may be warranted. There are many resources available which may be of help to you. To access these resources, please go to the Clinical Resources tab on the Maryland Department of Health's PDMP webpage. If you have additional questions about the PDMP, please visit the Maryland Department of Health's PDMP website or email or call the program. For technical support registering or accessing the CRISP portal, including PDMP data, please contact CRISP support by phone or email. Next, we will take a look at the CRISP portal.
Here is the CRISP portal website. First, you must click on Login at the top right corner. Select Prescription Drug Monitoring Program, PDMP, and then enter your username and password. If you don't have an account, you can register for the PDMP at crisphealth.org/register. Once logged in, you will see each application you have permission to view on your dashboard at the bottom. If you have an individual DEA, you can see information about your prescribing in the prescriber reports. If you have received an unsolicited report notification, you can view it under Unsolicited Reports. If you are a prescriber who has delegates or would like to add them, you can use the Delegator dashboard to do so. Anyone who can be a delegate at your organization can be added using the Delegator dashboard after the delegate has registered for PDMP access. When ready to access patient data, enter patient demographics in the field provided. First name, last name, and date of birth are required. Click Search. Once Search is clicked, any identity that matches the criteria provided will be displayed. Select the identity or identities that you want to view. If there are multiple that match the demographics you've entered, they will be listed. Select the patient that you are looking for. you will land on the PDMP Advisories page, which will give an overview of key metrics, including average daily MME, overlapping opioids, overlapping opioid and benzodiazepines, and the number of prescribers and pharmacies that the patient has visited in the last 90 days. Click on the PDMP tab to view PDMP data. You can query additional states by clicking on the Query Additional States option on the top right. If there is data from the additional states, the number of additional prescriptions will load, and you can click on the indicator to view interstate data results. The data warning will show you the states where there is no data available. You can click on Search and type in something specific that you are looking for in the patient's PDMP data. View columns can filter out columns that you may not need. The filter table can help filter the PDMP data so that you can view data from specific times, states, etc. The disclaimer lets you know what the MME per day is based on. You can also download the PDMP data as a PDF if needed. This concludes our introduction to the CRISP portal. If you have any questions, encounter errors, or would like access to more applications, please reach out to our customer care team or your group's point of contact.
Thank you for your time, and remember to use the PDMP every day to help prevent drug misuse and ensure prescription accuracy.